All right. So again, I want to just demystify the neuropsychological assessment. Sometimes when people hear they're going to come for this test, it's a neuropsych assessment, you start to get reactions like this. There's a little bit of a panic involved. People are scared. They're not sure what to expect. What is this going to be like? So I want to try to prevent that today. So hopefully by the end, what we want to do is have you understand a couple of things. What is neuropsychology? Who are neuropsychologists? What is the assessment? What are some of the purposes and reasons for doing it? How is this going to help you? And what happens during the assessment? When you actually come in, what is an appointment like, and what is it going to be the experience? Okay, so first let's just take a look at what neuropsychology is. It's sort of a combination of two different things. It's a combination of neurology, which is the study of the nervous system and the brain, and psychology, which is the study of behavior. So if we put that back together, neuropsychology is the study of what's called brain-behavior relationships. So it's a study of how the brain works, what parts of the brain are responsible for different abilities, and how injury or different illnesses or diseases affect the brain and our abilities to do different behaviors, do different things. So in terms of training, if you go see a neuropsychologist, they're first and foremost a psychologist. They have a doctoral degree in psychology, trained psychologists with general principles of psychology and therapy, and also with specialized education in neuropsychology and understanding the brain. And in order to practice, you need to be a licensed psychologist in the state of Massachusetts. Now, neuropsychologists do different roles. So my practice, like a lot of neuropsychologists, is primarily based on assessment. So I'm a consultant. I work with people, they come in, we do the assessment, and I provide that information to you and to your doctors. And in most cases, our interaction may end right there. For many neuropsychologists, they may do other things as well. They may be involved after the assessment with looking at cognitive rehabilitation, working with people with individual, family, or group counseling, like therapy, or doing behavior management. So it really depends on who you see people operate their practices most differently. So what is this neuropsychological assessment? What happens? First of all, it's a diagnostic test. I like to think of it as like a functional X-ray. So following an injury, you may get a CT or an MR of the brain, and it'll show you exactly what area has been damaged. But it really doesn't tell you anything about how somebody's functioning, how the brain is working. It just shows you where the injury is. So the neuropsych, on the other hand, tells us a lot more about how the brain is working from a functional perspective. And we can get some objective data on different thinking skills, or memory and thinking skills. Are there any changes in behavior? Look at personality and psychological and emotional functioning. So it's a measure of how the brain is doing, how you are doing after injury.
I had Dr. Cat today.
What's that?
I had Dr. Cat.